Today, I would like us to talk about basic medical terms that every nurse should know. You know, as a nurse or a future one, sometimes it is hard to keep up with certain medical terms, but you don't have to worry. Since you have the basics down, there's always room for you to expand your knowledge on the medical vocabulary. Let's get to know some of them. Certain medical terms are related to patient status. One is acute. When we say a patient is acute, we mean that this patient is with a sudden flare up or is potentially having a severe issue that needs an urgent attention. Outpatient means the status of a patient that does not require a hospital stay, or it doesn't require hospital admission or an overnight care at the hospital. Observation also means the status of a patient that allows the patient to receive treatment whilst the physician determines whether admission or discharge is the best. The first condition is abrasion. When we say someone has an abrasion, it's typically a scrape on the skin that usually can be treated at home. The next one is abscess. An abscess is a tender fluid filled or a pus filled pocket on the skin that is usually due to infection. Hello, welcome back everyone to my channel, Time with Nurse Joycelyn. If you are new here and it's your first time of watching my videos, kindly give me a thumbs up by liking my videos, sharing for me, and also subscribing to my channel if you've not done so yet. Put on your notification icons so that when I post new videos, you'll be able to see them. Thank you. Next one is aneurysm. Aneurysm is a bulge in the wall of an artery that weakens the artery and can cause a rupture. Next is aortic dissection. Aortic dissection is a tear in the inner layer of the aorta. Let's also talk about bradycardia. Bradycardia is the slowing of the heart rate or the heartbeats, typically less than 60 beats per minute in adults. Also, when we say something is benign, it's related to tumors or growth. We mean that the thing is not cancerous or is not malignant. Biopsy is a small sample of tissue that is taken for a test to discover the extent of a disease or the cause of the disease. When we say chronic, it signifies recurring condition that is persistent, usually for more than 3 months. What is contusion? Contusion is a bruise, typically from a force or an impact. Now, cyanosis. Cyanosis is a condition that results in the bluish coloration of the skin stemming from the lack of oxygen in the blood. Diagnosis. Diagnosis is the identification of a disorder or a condition by evaluation of symptoms, tests, or other factors. Next one is edema. Edema refers to a swelling caused by fluid accumulation. What is thrombosis? Thrombosis is a clot within a blood vessel that affects normal blood flow. An embolus is also a blood clot, air bubble, or an obstruction that blocks blood flow in the vessel that is being affected. Hypertension, just from the word hyper means high. So hypertension simply means high blood pressure. Hypotension, on the other hand, means low. Hypo means low. So a low blood pressure is hypotension. Malignant, also in reference to tumors, signifies the presence of cancerous cells. Cerebrovascular accident, or what we call stroke, is a condition whereby the brain or part of the brain is deprived of blood and oxygen. That is also either caused by a blockage or the rupture of a blood vessel. Ischemia. When we say an organ is ischemic or a part of the body is ischemic, that means that organ or part of the body is deprived of oxygen or blood flow. Pericardial effusion is also a term that refers to the leaking of blood or fluid into the pericardium, which is the sac that covers the heart. This is where we end this video on basic things that a nurse should know. I hope you all enjoyed it. Like and share the video for me. I'll see you next in my videos. Until then, be good.